for being here. And let me begin by giving you a warm welcome to BEDAH BUKU, spreading knowledge throughout the nations. I'm Richard, and I will be your MC for today. Before we start, we would like to use this chance to thank from Universitas Tisakti, Professor Dr. Gigi Triari Astuti, MKes, as the Dean of Faculty of Dentistry, Trisakti University. Dr. Wiwik Pujiastuti, MKes, SPBM, PhD, as the first Deputy Dean of the Faculty of Dentistry, Trisakti University. Dr. Rosalina Chandrawinata, MSI, PhD, as the second Deputy Dean of the Faculty of Dentistry. Dr. Abdul Ghani Sulisa, MPH, as the third Deputy Dean of the Faculty of Dentistry. Dr. Gigi Wita Anggriani, M. Biomed, SP Perio, as the fourth Deputy Dean of the Faculty of Dentistry, Trisakti University. From International Islamic University, Malaysia, Assistant Professor Dr. Salwana Supat, as the Dean of IIUM. Associate Professor Dr. Solashuddin Jauhari Arif, as the Deputy Dean of Student Development and Community Engagement. Assistant Professor Dr. Haselini Binti Hasan, as the Deputy Dean of Academic and Industrial Linkage. Associate Professor Dr. Khairani Idah Mokhtar, as the Deputy Dean of Postgraduate. Br. Haris bin Yunus, as the Deputy Director. Prof. Dr. Kamaruzzaman Yunus, as the Campus Director of IIUM Kuantan. From Universitas Gadjah Mada, Dr. Osa Amila Hafiyah, MD SC, SP Perio. From Universitas Indonesia, Dr. Melisa Adiatman, PhD. Dr. Gita Arifa Syarkawi, MKes. Dr. Arianti Rezeki, SP Pros. Dr. Silva Dini Alinda, SPKG, and Mars. Trust me when I say we have a lot of exciting things in store for you all today. After opening, we will start the first session of the webinar by Dr. Bernard Ongki Iskandar, SPKG, FICCDE, FICD, continued with a Q&A session. After that, we will take a 30-minute recess and start the second session of the webinar by Dr. James Handoyo, SP Pros, followed by another Q&A session. But do not leave yet. We will announce Best Mask winner. And lastly, just a heads up, at the end of this event, participants will be required to fill an attendance forms in order to get their e-certificates. So do not forget to fill it up. Before we begin the event, there are some rules and regulations for participants to follow, such as all participants on Zoom have to fill the registration form on Google before joining Zoom. Participants should turn on their video unless experiencing connection issues. Participants have to rename their display name on Zoom, country number _name. Participants should turn off the microphone or mute their microphone during the events unless allowed to do so otherwise. Questions should be kept until the end of the session. Please use your raise hand feature and wait for the MC to allow participants to speak. Participants have to wait until the end of the event and fill in their attendance form shown at the slide or at your Zoom chat to get the e-certificates from the committee. Any further questions, send a private message to the committee main account on Zoom and we'll answer to you shortly. And lastly, enjoy the webinar and gladly ask any questions you might have. We will begin the event by reciting prayers. To Geneva, we invite you to lead the prayer.
Assalamualaikum warahmatullahi wabarakatuh. Thank you, Richard, and everyone. Let us start with a prayer beforehand. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala sayyidina Muhammadin asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma antas salam wa minkas salam wa ilaika ya'uddu salam fahayyinna rabbana bis salam. Ya salamu salimna ajma'in wa ja'alna min ibadika salihin. In the name of Allah, the Beneficent, the Merciful, praise to be Allah. Let your blessing and your peace be on your servant and your messenger Muhammad, and on his family and his companions. Ya Allah, help us to remember you, to thank you, and to worship you in the best of manners. Forgive us, have mercy upon us, guide us, give us health, and grant us sustenance. Amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh. Thank you everyone. Richard, the screen is yours.
Thank you so much, Geneva. Next, we will continue with singing the Indonesian national anthem, Indonesia Raya.
Indonesia, tanah airku, tanah tumpah darahku. Di sanalah aku berdiri, jadi pandu ibuku. Indonesia, kebangsaanku, bangsa dan tanah airku. Marilah kita bersatu, Indonesia bersatu. Hiduplah tanahku, hiduplah negeriku, bangsaku, rakyatku semuanya. Bangunlah jiwanya, bangunlah badannya untuk Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang kucinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang kucinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya.
Thank you, everyone. Once again, we would like to welcome all participants and invitation guests to BEDAH BUKU Spreading Knowledge Throughout the Nations, one of the many sub-programs on Nusantara Smile Campaign 2021. This event is organized by 4 dentistry universities, Universitas Trisakti, Universitas Indonesia, Universitas Gajah Mada from Indonesia, and International Islamic University Malaysia. If you guys want to upload today's events on Instagram, please kindly tag us on @Nusantarasmile2021 and @BEM-FKG Tisakti. Now, we would like to invite Prof. Dr. Gigi Triari Astuti, MKes, as the Dean of Faculty of Dentistry, Trisakti University, to give an opening speech. To Prof. Eri, the screen is yours.
Okay. Thank you very much, Richard. Your English is excellent. Okay, Bismillahirrahmanirrahim. The Honorable Dean's Associate Professor Dr. Salwana Supaat and all the beauty deans of the Faculty of Dentistry, International Islamic University Malaysia, the Honorable Professor Dr. Kamaruzaman Yunus as a Campus Director of IUM Kuantan, the Honorable Representative Lecturers and also the International Officer from the Faculty of Dentistry, Universitas Indonesia, Universitas Gajah Mada, and also Universitas Trisakti. The Honorable Vice Dean, the Faculty of Dentistry, Universitas Trisakti, and of course, and all my beloved students from Indonesia, Malaysia, Brunei, and Singapore. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, shalom. Om Swastiastu, Namo Buddhaya, Salam Kebajikan, and of course, good afternoon, everyone. Welcome to the BEDAH BUKU event. First of all, I would like to express my gratitude for the opportunity to involve in the collaboration between Faculty of Dentistry from 4 great universities, International Islamic University Malaysia, Universitas Indonesia, Universitas Gajah Mada, and also Universitas Trisakti. BEDAH BUKU is one of the 7 programs of Nusantara Smile campaigns, which aims to enable dental students to improving the knowledge regarding oral health throughout the communities. So today, we are here to improve our knowledge that will be shared by Dr. Bernard Iskandar. He's an endodontist, and also Dr. James Handoyo. as a prosthodontist from Faculty of Dentistry, Universitas Trisakti. Thank you, Dr. Bernard and Dr. James for your time. And also, of course, in this opportunity, I also would like to thank all the committees and everyone who's supporting this event. We were unable to successfully conduct the BEDAH BUKU without the hard work and dedications of the communities. Okay, I don't want to take too much of your time because I also have another event with all the deans from Indonesia. I would like to say once more, thank you and enjoy the BEDAH BUKU. Wal taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Salam sehat. Thank you. Back to Richard.
Thank you so much, Prof. Eri. Now, we may continue by documenting all of the participants to the committee. You're welcome to do so. So all participants, please wear your most unique mask, since there will be 4 lucky participants to win Best Mask Awards at the end of the event.
Okay, thank you, Richard. I'm going to take screenshots for the documentary. For the first page, 1, 2, 3, smile. For the second page, 1, 2, 3, smile. For the third page, 1, 2, 3, smile. For the fourth page, 1, 2, 3, smile. And for the last page, 1, 2, 3, smile. Thank you, Richard.
Thank you so much. Now, it is my pleasure to introduce our first guest speaker, Dr. Bernard Ongki Iskandar, SPKG, FICCDE, FICD, with the topic of 3F, finding, following, finishing, endodontics. Dr. Bernard Ongki Iskandar, SPKG FICCDE, FICD, was born in Ujung Pandang, Indonesia on the 30th of December, 1959. He has his own clinic called Sukses Dental Clinic in Raya Jatinegara Barat, Jakarta. For more information, you can contact him through this number and email provided on your screen. In 1984, Dr. Bernard attended Vita VMK course and CM Dental Golds and Attachment Tech in German. Then Dr. Bernard graduated from the Faculty of Dentistry Trisakti in 1985. In 1989, Dr. Bernard got certified by International Linko Institute in German. In 2002, Dr. Bernard joined training on microscope for microendodontics. In 2008, Dr. Bernard graduated from Gajah Mada University from a postgraduate program in operative dentistry and endodontics. 1986, he began teaching at Public Health Department while also teaching at Microbiology Department in Faculty of Dentistry, Trisakti University. 1989 till the present day, he teaches at a conservative and restorative department in the Faculty of Dentistry, Trisakti University. Dr. Bernard then became a clinical instructor for the undergraduate program in conservative dentistry department. In 1999, 2000 and 2002, he became a supervisor and also clinical instructor for continuing dental education and course in endodontics. From 2013 till 2017, Dr. Bernard was appointed to be the head of conservative and restorative department, Faculty of Dentistry, Trisakti University. Dr. Bernard was also the chairman of IKORGI, West Jakarta chapter, for 3 terms from 2008 until 2017. Dr. Bernard is now a program director of postgraduate study in conservative dentistry and endodontics in the Faculty of Dentistry, Trisakti University since 2017. In 2000, he founded the Building Solid Foundation Study Club, Endodontics, and since November 2002, he began to introduce a microscope for endodontics. And lastly, Dr. Bernard is a member of IDA or PDGI, IKORGI, AAE or American Association of Endodontists, Fellow of International College of Continuing Dental Education or FICCDE, Fellow of International College of Dentists or FICD. I would like to remind all participants, if you guys want to upload today's events on Instagram, please kindly tag us on @Nusantara campaign, @Nusantara 2021 and @BEM Tisakti. We also would like to remind all participants to keep their questions until the end of the presentation. Now, without further ado, to Dr. Bernard, the screen is yours.
Thank you, Richard. Well, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, professors, doctors, colleagues, and all to my students. I hope that we are in all good condition. Thank you to attendees who have taken the time to attend this forum that I'll convey at this opportunity. It is an honor for me to be here and sharing knowledge. First, let us pray for the presence of God, the merciful God who has bestowed our pleasure for the health, the opportunity, and the happiness we feel today. Without mercy, it is impossible for all of us to enjoy this moment. Furthermore, allow me to thank the organizing committee who has prepared this forum very well. Without further ado, I will talking about my experience in practicing endodontic. Let me share my screen. Richard, that you can see my screen already?
Yes, doctor, I can see your screen clearly.
Okay. Today, I will be talking about the 3F. 3F is finding, following, and finishing endodontic. The 3F is guideline for what to do when doing endodontic treatment. As you can see from the X-rays today, the peripheral radiograph show that those tools need endodontic treatment. And what is endodontic treatment is? Endodontic treatment procedures that are designed to maintain the health of all or part of the dental pulp. When the dental pulp is diseased or injured, treatment is aimed at preserving normal periodontal tissue. And when apical periodontitis has occurred, treatment is aimed at restoring the periapical tissue to health. This is usually carried out by root canal treatment, occasionally in combination with surgical endodontic. The endodontic treatment consists of 3 principles, such as shaping, cleaning, and packing. Specifically, was described as the debridement is using a medical instrumentation to remove of the vital and necrotic pulp tissue, removal of the infected dentin, also to create a space for irrigant solution. 2, disinfection. With irrigant solutions, such sodium hypochlorite are used to disinfect the root canal system. 3, obturation. Fill in the root canal space with obturation material in 3 dimensions. The technique for process of achieving shaping, cleaning, and packing is the best understood from the perspective of the proper of 3F technique sequence. The 3F finding, following, and finishing canal focus on the biological and mechanical objective required in treating every endodontic canal. Now we go to the first F, finding. Finding orifice and canal is one of the biggest technical problem that needs to be overcome in order to treat the patient endodontically treated disease tooth. Finding canals is not always easy. As you can see from this slide, we have to find the MB2 canal and the maxillary molar. Before beginning finding the orifice and the canal, access cavity should be done first. So, what is the objective of the access cavity? The objective of the access cavity is to provide a smooth, free-flowing tapered channel from the orifice to the apex that allow instrument, irrigant, and medicament to attempt cleaning and shaping and the entire length and circumference of the canal, with a minimal as loss of true structural integrity to the tools as possible. Doing access cavity, one should follow the guidelines such as access cavity design should be thought as one of one size fits all. Access cavity should be prepared according to the access requirements. Unnecessary and excessive destruction of tools must be avoided. All carriers and roof of the pulp chamber must be completely removed. A good temporary restoration should be placed and to prevent the coronal leakage. These are the diagram of how we can make a good access opening, the design, and this is the result. The technique of access cavity, we can use this type of bore to make an access cavity. Before beginning the access preparation, all defective restoration and carriers should be removed. Leaving a leaky restoration or carriers can permit bacterial contamination during and following treatment. The goal of every access is to remove the pulp chamber roof completely. With the diamond bore, penetrate the occlusal surface until a drop sensation is felt. That means we are already on the pulp chamber. Then remove the pulp chamber roof completely. With a small angle probe, it is easy to confirm completely removal of the pulp chamber roof. To remove the pulp chamber roof completely, there are two ways to unroof. Either place a straight line, a straight bore, and move it laterally while keeping it parallel to the long axis of the tools, or place a bore into the axis engaging laterally under the remaining overhang, then withdrawing the bore occlusally. After completely unroof the pulp chamber, then irrigate to remove the dentin debris from the pulp chamber. With the probe, try to locate the orifice in the pulp chamber floor. According to the law of color change, the pulp chamber floor is always darker than the surrounding walls, like this in the picture. The pulp chamber floor is always darker, the color is surrounding walls. Orifice location. The number of root canal orifice in particular tools can never be known prior to the commencement of treatment. Although radiographs are helpful and can sometimes indicate the number of root, like on this X-ray, we can see at least two canals with two branches each canal. There is maybe 4 canals on the two. There are 4 canals on the 2 roots. Every tooth, to find the orifice, the canal we have to understand the concept and law of orifice location. 2 categories of anatomic patterns were observed: the relationship of the pulp chamber to the clinical crown and the relationship of the orifice to the pulp chamber floor. The relationship of the pulp chamber to the clinical crown is mainly for the access cavity. Now let's talk about the relationship of the orifice to the pulp chamber floor. That the pulp chamber floor is always darker than the walls. You can see from this white arrow. And the orifices are located at the junction wall and the floor line angle. That means that all the long line angle, maybe there is a orifice on that area. The orifices are located at the angle of wall and floor junction. And orifices are located at the end of the root developmental fusion line, or we call that the root map. Like that one, the white arrow. Now we go to the orifice location law of symmetric one. Orifices of the canal are equidistant from the line drawn in the mesial distal direction through the center of the pulp chamber. For example, if we find the orifice on the mesial buccal, the distance to the line draw from mesial to distal is the same with the orifice location and the mesial lingual side, like that one. Now, this law of symmetrical 2. This orifice of the canal lies on the line perpendicular to a line drawn in the mesial distal direction through the center of the pulp chamber. The mesial buccal orifice and the mesial lingual orifice are the same line. So when we try to find the orifice, don't look too much on the other area, just follow the line, the straight line. If the canal in the center of the chamber of the mandibular molar, there is only one distal canal like this one. And you can follow the root map, the dentine root map. On this slide, you can see the orifice of the mesiobuccal and the mesiolingual and also on the distal. Following the law of symmetrical and law of location, we can find the mesiobuccal and mesiolingual orifice. However, if there is a canal in distal lingual or distal buccal of the mandibular molar, 100% of the time, there will be another orifice in another corner of the access cavity. If you can see, the distal buccal orifice we have found, but this position is more on the distal, on the buccal. So it means that there is another canal orifice on the distal lingual, like see on the black arrow. Using an ultrasonic tape, we can remove the calcified dentin that cover the orifice, and then we can find the orifice on the distal lingual. This is the end after we clean everything. This is a typically orifice location of the lower mandibula with the 4 canals. This is diagram give us information that inadequate extension of the mesial area, because we only find the distal and they cannot find the orifice on the mesial. There's an adequate access cavity on the mesial side. The B, inadequate extension of the distal access. The C is overextension of the access cavity. It's too much structure we take during access cavity. The technique to improve finding orifice and canals are make a good access cavity, clean the pulp chamber from the dentin debris, like this one. Okay, find the dentin root map, then we can locate the orifice. After that, now we can go to proceed to the F. The second F is following. Following is gliding down the canal with instrument until the radiographic terminus. This is proposed to secure the canal pathway. Every tools have there already a canal pathway. Sometimes we can sometimes we see very clear on the pathway, and sometimes it's not so clear. It's hard to see. This is to anticipate when doing the initial canal negotiation from orifice to the apical terminus. This is to prevent blocking or leakage during clearation the canal pathway. Manual initial canal negotiation is using a small cave file that introduced to the orifice, follow the root canal pathway to the apical terminus. Manual mechanical motion based on operator skill. This is to be consideration while pushing the file too hard and make it a blockage to the dentin, and maybe lags or transportation, or even worse, if the file is broken. Or we can use a rotary instrument to make a glide path. This is to secure the canal pathway from orifice to the apical terminus during canal preparation. This video shows that the technique to secure the canal pathway using a K-found, prevent the K-found before entering the root canal. Then using the watch winding motion, push it down to the apical of the root canal. With this, we can create a glide path. This glide path is a smooth radicular tunnel from the canal orifice to the physiologic terminal of the root canal. This is to secure when we're doing a canal preparation with a larger instrument. Now we go to the finishing F. The finishing F consists of 4 steps. First, shaping, cleaning, confit, and obturation. After we create the glide path, now we go to shaping the canal. Shaping the canal is remove the restrictive dentin using a shaper and finishing file. Follow the shielded principle. What is the shielded principle is? Develop a continuous tapering conical form in the root canal preparation. Make the canal narrow and apical with the narrowest cross-section diameter at the terminus. Make the preparation in multiple plane. Never transport the foramen apical. Keep the foramen as small as practical. Canal preparation can be done whether it's a hand or engine-driven instrument that are used from coronal to apical direction, or we call that the crown-down concept, which is commonly practiced. The crown-down concept is prepare the coronal aspect of the canal first, then followed by the sequential smaller file penetrating the canal until the working length is reached. The major goal of mechanical root canal preparation is to prepare the canal space to facilitate disinfection of irrigant solution and medicament. Thus, the canal preparation is the essential phase that eliminates infection, prevention of the infection, and then achieves through the provision of fluid-tight root canal filling and coronal restoration. Now we go to the cleaning. Cleaning means irrigation. It's the removal of vital and necrotic remnant of the pulp tissue, microorganism, and microbial toxin, also dentin debris from the root canal system. The function of irrigation, there is 2 functions of irrigation. One is the chemical effect, the other is the mechanical effect. The chemical effect is to inactivate the bacterial biofilm and the toxin and dissolving tissue remnants smear layer from the infected root canal. The mechanical effect is to allow the flow of irrigant throughout the root canal system in order to detach the biofilm, flush out the debris from the root canal, and also as a lubricant. We have to take some clinical note that the apical 3 mm of the canal is considered to be the critical zone. Why? Because of all the dentin debris is packed on that area because of the shaping procedures. Thus, canal disinfection of the root canal system must be to full working length. The optimal result of the irrigation was agitate. There is another study showing that conventional needle irrigation leave a large amount of debris clogging in the irregularities of the root canal. Why? Because the needle irrigation are not enough flow of irrigant beyond the irrigation needle to detach the biofilm to flush out the debris from the root canal. What is the most irrigation used for cleaning and shaping? Most used is sodium hypochlorite. The concentration is 0.5 to 5.2.5%. The ADTA is 70% and the chlorhexidine is 2%. Now we go to the mode of irrigation. Mode of irrigation. Needle irrigation is a positive pressure irrigation. It's most used, but please be careful not to push too hard because maybe we can extrude the irrigation solution to the apical area. We're using a side-vented irrigation needle with the flow rate of 5 ml per minute with the pumping action. The length of the needle irrigation is 2 to 3 millimeters shorter than the working length. This is to prevent the extrusion of the irrigation solution to the apical area. The other is the dynamic agitation. Dynamic agitation is using the master gutta percha cone to the working length and insert the master gutta cone to the working length at a frequency of 100 strokes per minute. This is a significantly facilitate debris removal from the apical portion of the root canal system. The other system is sonic or ultrasonic. We can agitate the solution for 10 seconds per canal. Sonic is a 20 Hertz to 20 kilohertz, the frequency, and the ultrasonic is 20 to 30 kilohertz. With sonic or ultrasonic, all the debris can very easily be removed from the irregularities of the two structure. Now the irrigation protocol we have to follow. That after access cavity preparation, flush the cavity and canal orifice with sodium hypochlorite. Canal must be always kept wet with sodium hypochlorite during canal preparation. Between irrigation, irrigate with sodium hypochlorite 2 to 5 ml per canal. After shaping, sodium hypochlorite is irrigated 5 to 10 ml per canal. Removing the smear layer, we can use ADTA or citric acid, the 5 ml per canal. Option activation of sodium hypochlorite is the best to remove all the debris from the irregularities of the root canal system. Between irrigation, we have to irrigate with the saline to protect the precipitation of or reaction between the irrigation solution. Irrigation with the chlorhexidine 2 to 5 ml per canal is the purpose to make an antibacterial effect after the cleaning and shaping. According Dr. Herbert Schirrer, make a note that what you remove from the root canal is more important than what you place inside. So irrigation is more important than the others. Now we go to the cone fit. After shaping, cleaning the cone fit. The cone fit is to select a master gutta percha that corresponds to the final preparation file. If the matching cone is not fit the matching file, cone sizing is improving. So this is to facilitate the fluid tight seal in the coronal in the root canal after obturation. Proper selection of master gutta percha cone is an important step in the obturation procedures. Clinicians usually prefer manufactured gutta percha cone that match with the taper and diameter of the master apical size 90 rotary instrument. So how we know that the master guccia percha is the right one we choose? The cone must be fit to the appropriate length with the snugness or a fill of top back. Check the fit of cone with radiographically. The cone to be up to the cone to the radiographic terminus. Obturation. Obturation has been considered one of the critical steps of root canal treatment, and when not properly performed, a potential cause of treatment failure can occur. The main objective of root canal obturation is the three-dimensional sealing of the complete root canal system. As we have seen that gutta percha is the most common material used for root canal obturation and must be combined with the sealer to lute the material, the root canal wall, and to fill the canal irregularities. After obturation, we have to make an X-ray from different angle to make sure that what we fill the root canal system is already in 3 dimensions. Because the root canal system, when we take an X-ray from one direction, like the buccal to the lingual, we only see like a one line. If we make another from the other angle, we can see how the complexity of the root canal system. So the goal of 3D obturation, the 3D obturation is a fluid tight seal of the root canal system to serve to prevent percolation and microleakage of the apical exudate into the root canal space by completely obliterating the apical foramen and other portal of communication, thus create a favorable environment for process of healing take place, like this photograph, the X-ray, that we can fill with all the 3 dimensions. All the accessory canal are sealed with the sealer. The other X-ray is we fill with this 3 dimension, and we appreciate the complexity of the root canal system. This is how we apply all the information about the 3F. For example, this case. From the X-ray, we know that this case, these tools need a root canal treatment. Before treating this case, we have to make a good diagnosis and treatment planning. Then put the rubber dam, make a good access cavity or remove the existing restoration. Clean the pulp chamber from the dentin debris and try to find the orifice with the orifice law that I've already talked to informed to you. Then try to follow the root canal with a small K file. This is to create a glide path and irrigate. This is a final of the canal preparation. And then cone fit. Check the master cone that we have to fill in the root canal. Dry the canal. Don't forget to irrigate with this sequential sodium hypochlorite, ADTA, and the end with the chlorhexidine. And then between irrigation, please irrigate with the saline. Then dry the canal. And we can obturate with a master gutta percha cone with sealer. This technique, I'm using a warm vertical technique to make a 3D obturation. This is the result. The canal preparation is follow the Schilder principle that I've mentioned that before. So this is before and after. Take-home message. Dentists should know the procedure of endodontic treatment from start to the end. Each step needs to perform predictable with the plan. Know what to do if you are not getting there. The 3F, find, follow, and finish, is a route map to get where we need to go in endodontic treatment. This is the end of my slide. That we can simplify everything in endodontic, but we cannot simplify the anatomy. Thank you. Richard, back to you.
Thank you so much, Dr. Bernard, for sharing with us. Now we continue into our next agenda, which is a Q&A session. To all participants, please use your raise hand feature to ask your questions, and we will be with you very shortly. As we can see, there is already a few participants who has questions regarding the topics. The first question, Yasmin Ahmad, you can unmute your microphone and you can please ask your question directly.
Assalamu alaikum. Thank you so much, Prof, for the nice sharing. I would like to ask, what's the implication if we don't use EDTA as our final irrigation? If we just irrigate with sodium hypochlorite only, what will be the implications? Thank you.
Thank you. It's very good questions. The sodium hypochlorite is irrigation that only remove the dentin debris or disinfect all the microorganism. Every canal preparation, we create either a dentin debris or a smear layer. The EDTA is to remove the smear layer from the dentin wall. The smear layers is like a barrier that the sealer and the gutta percha is not adapt very well. So we have to use a EDTA. EDTA is a silating agent that remove a smear layer. Is that answer your questions? What happens if we are not using EDTA? Yes, maybe the obturation is not perfect because there's maybe there is maybe a barrier between the gutta percha and the dentin wall, and it's become potential for leakage in the following year. I hope that this answer your questions. Thank you.
Thank you so much. For our second question, from Cindy Kofianti, you can please unmute your microphone and ask your question directly to Dr. Bernard.
Good afternoon, Dr. Bernard. Actually, I have two questions. The first one is, how can we tell that our endodontic procedure is completely successful? Is it because of hermetic obturation or something else? And the second one is, how can we decide that our case that we want to treat is using single visit endodontic or multi-visit? Thank you, doctor.
Thank you, Cindy. It's a very good question again. How we know that our endodontic is successful or not? There is, according to the literature, there is success means that if the tooth is retained for a long time and function in the stomatic system. The most, I mean that how to know that the endodontic treatment is give healing to the patient. First, when the patient report that there is no pain while it's using. And we can also evaluate from the X-ray from time to time. At least 6 months after the case is finished, we have to make an X-ray, see if the lesion is getting smaller or getting bigger. If they're getting bigger, it means that our treatment is not properly done. Okay, the second question is, can you repeat the second question, is Cindy?
Yeah, doctor. The second question is how can we decide that our case?
Oh, yeah, yes. Our case is single visit or multiple visit.
Yeah, thank you, doctor.
If you're dealing with the vital tools like irritable pulpitis, the pulp is not contaminated with the microorganism, so we can finish the treatment in single visit, but we have to prepare everything because the endodontic treatment is single visit, takes time. Okay, sometimes 1 hour until 1.5 hours. To visit endodontic and multiple visit endodontic, usually when we're dealing with a necrotic case. Dealing with necrotic case means that we have to dealing with the microorganism, and from the cleaning and shaping, it's very difficult to make sure that all the canal preparation can be free from the bacteria, because the system is so complicated and that is so complicated, and it is impossible to irrigate all the system that we can remove all the bacteria from that one. So may I advise that when we're dealing with the necrotic case, it's better to make a 2 session or maybe longer than that, especially when we're dealing with an abscess. Does that answer your question, Cindy?
Thank you, doctor.
Thank you.
Thank you, doctor. Thank you, Cindy. I would like to remind all participants to please turn on your camera before you ask any questions. I already have a few questions here coming in from my private messages. Please use the raise hand feature instead of using the private message to ask your questions. But I'll read a few questions here for Dr. Bernard. Are hand and rotary nickel titanium files beneficial? And what is the best system in your opinion?
Hand and rotary system give the same result. Hand with the hand will maybe take more time when using with the rotary system. Okay, with the rotary system we can maybe clean and in more easy compared with the hand instrument. Okay, those both are giving a good result at the end if you can use it the hand with a skilled. Okay, rotary is more easier because it's more easier and it's more faster than a hand instrument.
Okay, thank you. I have a few more questions here coming in my private messages. I would just like to remind all participants to please ask your questions directly to Dr. Bernard by raising your hand and turning on your video. However, I'll read some of the questions here. How important is irrigation to the procedure? And what if we forget to do it?
Yes, if you forget to do it, all the debris are there. And all the debris is consists of microorganisms, and the endodontic treatment will be failed shortly. Okay, irrigate, because when we cleaning, when we're shaping the canal, we create the dentin debris. This dentin debris have to be removed from the canal system. So either with, if you don't have any sodium hypochlorite, saline is okay, but it's not recommended. The end is with the saline, with the sodium hypochlorite. Yes, don't forget, if you want to do endodontic treatment, please follow all the protocol for endodontic treatment, like initial canal negotiation, and then working length determination, shaping, and irrigation is most important that I said before.
Thank you, Dr. Bernard. I have two more questions here. The first question is how to easily determine the root of the molars.
How to determine the root of the molars? Usually we can take an X-ray from a different angle, so we can determine the root of the molars. Okay, this is, we call that the buccal objective rules. So we can use a different angle, or maybe we can use a CBCT to know the morphology of the molar. Okay. Yeah.
Thank you so much, Dr. Bernard. And the last question here in my private message. Should irrigation be sequential? If not in order, what happens? If it's not in order, what happens?
Yes, irrigation should be in sequential. During canal preparation, we only use the sodium hypochlorite to disinfect all the microorganisms, to dissolve the necrotic tissue. And after the cleaning shaping, after the shaping is finished, we have to remove the smear layer using other irrigation such as ADTA or citric acid. All this irrigation have their own function. Sodium hypochlorite is only to kill the bacteria, dissolve the dissolved tissue and remnants. The ADTA is to remove the smear layer that is in the dentin wall. And the other one is this chlorhexidine. Chlorhexidine is give a benefit for the antibacterial effect, because after we cleaning with the ADTA, all the tubulus of the dentin is open, and we can put some bacterial effect on the dentin tubula, because we know that the microorganism may be still in the dentin tubula. So we have to make an order. During canal preparation, we only use the sodium hypochlorite, and before obturation, we use the sodium hypochlorite and then irrigate with saline solution, followed by the EDTA, and then irrigate again with the soda with saline, and the last one with the chlorhexidine. And then we can dry the canal, and we can proceed with the obturation. It should be in order. To get the maximum result.
Okay, thank you so much, Dr. Bernard. We have a few more questions here coming in from Cindy Kofianti. You can unmute your microphone and please ask your questions directly.
I'm sorry, doctor. Actually, I have one more question that I want to ask. I have heard one opinion that we can do the obturation if the tooth canal is completely dry. That means our case can be single visit. Is it true or not, doctor?
Sorry, I cannot hear you very clear. Can you repeat?
I mean, like, I have heard one opinion that we can do obturation if the canal is completely dry. Means our case can be single visit. Is it true, doctor?
Yes.
Thank you.
Okay, thank you, Cindy. Before the obturation, you have to make sure that all the canal is dry. Okay. If you cannot dry the canal because of maybe a bleeding, or maybe there is an abscess, you cannot fill the canal on the single visit. You have to wait until the canal is dry. If the canal is wet, you cannot get a 3-dimension obturation. You cannot get the fluid tight seal of the obturation to the canal system. You have to wait until it's dry. Okay. Thank you.
Thank you, Doctor.
I have a question here coming in from Agnes Santosa. Which technique is better, crown down or step back? And what is the indication of use?
Crown down and step back. Now, in my faculty, we're teaching the students with the crown down technique. Okay. The step back technique is usually we use when we're dealing with a ledge. Okay. We're using a step back technique when using we're dealing with a ledge. Okay. But most of the time we're using a crown down technique. Crown down technique is have an advantage that we can reduce the debris extrusion to the apex because because we clean first on the on the coronal first, then going down to the apical. It means that we remove already the most bacteria in the coronal aspect, and then we go to the apical. Yes.
Thank you so much, Doctor. If you have any more questions, guys, you can ask directly. But unfortunately, due to our limited time, due to our limited time, that's all for the Q&A session for today. Before we go on, however, we kindly ask Dr. Bernard and all the participants to please turn on their cameras, as we will now take documentations. To all the committee, please go right ahead to take documentations. I would like to remind all participants to please turn on their cameras for documentations. Thank you.
Okay, thank you, Richard. We have the photo session for the first page. Okay, 1, 2, 3, smile. Okay, thank you.
Thank you, Richard. Thank you all. Thank you all.
Thank you so much, Dr. Bernhard, for taking time out of your busy schedule to be the speaker on BEDAH BUKU. Thank you. Before we continue to our next session, we are going to take a 30-minute recess. It would be better for all participants to please not leave the Zoom meeting. However, turning off the camera is allowed. Enjoy your recess, and we'll be back for more interesting topics. Thank you. turn on the camera as we continue to the next event. Thank you. The second session will begin in a few minutes. A gentle reminder to all participants to turn on their cameras as we continue to our next event. Thank you. Before we start to our next session, I would like to redo the rules and regulation. I would like to read the rules and regulations for you guys to follow. So the first one, a few rules and regulations. The first one would be participants should turn on their videos unless experiencing connection issues. Participants have to rename their display name on Zoom, country number _ name, one for Indonesia, 2 for Malaysia, 3 for Singapore, 4 for Brunei, 5 for other countries. Participants should turn off the microphone or mute their microphones during the events unless allowed to do so otherwise. Questions should be kept until the end of the session. Please use your raise hand feature and wait for the MC to allow participants to speak. Participants have to wait until the end of the event and fill in the attendance form shown at the slide or at the Zoom chat to get the e-certificates from the committee. Any further questions, please send a private message to the committee main account on Zoom and we'll answer to you shortly. Thank you. Thank you so much, everyone, for signing back in. Now, it is my pleasure to introduce our second and last guest speaker, Dr. James Handoyo, SP Pros, with the topic of A Note to My Younger Self, Prosthodontics.
Thank you, everyone. So,
sorry, doctor. Let me.
Okay, you're gonna read my CV first.
Sorry, doctor.
I jumped the gun.
Sorry. So, Dr. James Handoyo, SP Pros, graduated from the dentistry faculty of Trisakti University in 2006. Following his passion for teaching, he returned to his alma mater as a lecturer in the faculty of dentistry. In 2007, he pursued a master's degree in prosthodontics at University of Indonesia and graduated in 2011. Currently, Dr. Handoyo serves as an assistant professor at prosthodontics department and the head coordinator of fixed partial denture sub-department at Trisakti University. He is a very passionate lecturer who enjoys exploring new ways of teaching and integrate education with technology. Since 2011, Dr. Handoyo has been passionately giving lectures and conducted numerous workshops around Indonesia. A lifelong learner himself, Dr. Handoyo has participated in various courses in Singapore, Malaysia, Thailand, Japan, Taiwan, and Australia. He is also a board member of the Indonesian Prosthodontics Association since 2015. Dr. James Handoyo is also an active prosthodontist at 2 private clinics in Jakarta. He believes in serving his patients with compassion and that every tooth matters. He specializes in full mouth rehabilitation, biomimetic restorations, implant-supported restorations, fixed partial dentures, and TMJ disorders. In his spare time, he enjoys good food, traveling, and playing computer games. Before we start, I would like to remind all participants, if you guys want to upload today's events on Instagram, please kindly tag us on @Nusantara Smile 2021 and @BEMFKG Usakti. We also would like to remind all participants to please keep their questions until the end of the presentation. Without further ado, to Dr. James, the screen is yours.
All right. Thank you, Richard. Okay, nice to meet you all. I'm Dr. James. I think I don't need to introduce myself. It's been done by Richard. So let me get back to the presentation. I'm asking for permission to stop my virtual background because I want to do something that you guys might not seen before, which is, yeah. Okay, so now you all you're bored about share screening. So I'm gonna do some split screen so you can see my face, my handsome face, and also the presentation as well. Okay, so this is a very light topic, which is a note to my younger self. But before we start, I would ask to all of you to not see me as a lecturer, but see me as like a senior class, like a class senior, like a senpai. Okay, do not see me as a lecturer, because this a note to my younger self actually pop up after I heard the audience of this presentation are dental students between year 1 and to 5. So I had a flashback about my early years at the dental school. Not that I've regretted to entering dental school, but I've regretted many wasted potentials, many wasted opportunities that, yeah, I wish in my early years in dental education wasn't just to prepare me to academically to become a dentist, but also to adapt professionally in the working environment, which, as you can see, everyone with my younger self. This was taken a long time ago. Me and my friends, we went to Dunia Fantasi. It's the only theme park in Jakarta. Okay, so as you can see, I was 19 years younger, 15 kilos lighter, more hair, and as close as the trash bin next to me. Jokes aside, I wasn't kidding about the coolest part. So at that time I was going through the motions. Okay, I knew I must finish my dental school. Listen to the boring lectures, hitting the textbooks, aces my test, and magically transform into a dentist. But I haven't has a slightest idea. Do I want to be an average dentist? Dentist. Sorry, dentist, or I want to be a good one. My goal was short and simple. I eat, I sleep, I finish my dental school, and the rest of my time is wasted on games and friends. Maybe some of you can relate me on that. So my purpose of this talk is to give you a sense of purpose and maybe a positive ambition. So you will not just graduate as an average dentist, but also a skillful one who's ready to work in the current clinical environment. As technology evolves, so does the dental landscape. This talk may be applicable for this and a few years ahead, but with the COVID-19 pandemic hugely impacting everything that we know, even in us in the dental landscape, the future seems less certain. That's why you must start to equip yourself with additional skills, so you can adapt what the future brings. Okay, so I would describe the first thing first is the traditional dentist is like a lone wolf. It's you against the world. You must able to treat every cases. Why? Because back in 90s and older, the dental schools is not that much. There are fewer dentists and more patients. So lone wolf kind of dentist was doing okay. He can treat many cases, but there are limits in the quality of work and the degree of the case complexities. As the saying goes, jack of all trades, master of none. Have you heard that one? It means you can do a lot of things, but maybe you're not very probably good, and you're not too good in any of them. While in modern dentistry, as dentists shines even better when we work in teams. We work like a pack of wolves, we can overcome bigger beasts. So we're more confident, we're more specialized, we do better quality, and we can give even more complex treatment to the patient. This is the trend of the dental clinic model nowadays. So in my opinion, interdisciplinary collaboration is the best what the dentist can achieve. The feeling of you as a part of the winning team, knowing that you contributed significantly to the outcome, is very rewarding. Not just in a monetary sense, but it shapes your work ethics, communications, and pushes your skills even more. And all of those hard work will transform you to become a better dentist. Better dentist means better health service, right? So this is me working together. I work in the clinic with many dentists. So this is me working with my boss. He's also a prosthodontist. So what kind of a cases can we handle with that much teamwork? This is the case what we call a full mouth rehabilitation. Sorry, I was kind of tense. So I'll try my best. Okay. So full mouth rehabilitation is one of the good example of the complex cases. It needs meticulous planning, layers of treatment, and during one of those treatments, anything can happen. One must be flexible and bring out your best game. So this is before and after. This is the result. I cannot take credit in this because it is a teamwork. 4 dentists are doing the whole treatment. 2 prosthodontists, 1 periodontist slash implantologist, and the other is the endodontist. The treatment lasts for 1 year because it was postponed during the COVID-19. But this kind of treatment, I don't think a lone wolf dentist can do all of this with a very better outcome. So I personally think the right working mentality in this modern dentistry is a pack mentality. In this day of age, and in this day and age where everything is connected and the challenge become more complex, whether you end up doing a solo practice or work in the big clinic, we will work together in the end. With that said, I think dentists are social animals. We need others to learn and to work with. We need others to discuss and to mentor. This is the reality of working environment in dental care. And my first note to my younger self is, you can survive on your own, but you can also grow with others. This is my first note. Okay. My second note to my younger self is to learn basic business. So dentistry, apart from medical point of view, is also a business. I'm not saying you have to be a money-hungry dentist or you have to open a very commercialized clinic. Actually, I do not have any respect for those kind of dentists. But learning basic business skills might help shape your purpose while you're finishing your dental school. There are 3 things I want you to know about basic business. The first is the USP, or the unique selling proposition. The name itself already is self-explanatory, but you need to understand how USP will influence your dental career. Later, when you're magically transferred to dentist, there will be 1,000 of us, 1,000 of us dentists. There will be hundreds of clinics, correct? We will become a fish in the ocean. If you don't want to become marginalized, then you have to be unique. And this is what a USP is for. So this is where your interest or your passion might help you to become unique. Is there any specific field of dental that intrigues you? It might help if you forge the path to specialistic or master's degree. Is it surgery, aesthetic, restoration, conservation, or maybe you like doing research? If you haven't found the answer, keep looking for it. Take your time. Sometimes the inspiration comes when you see the work of other dentists, or maybe the person itself that maybe inspired you. The second part is the business is market segmentation. This is the truth about business. You can't treat all the dental problems in the market. Therefore, we need to choose on which market so we focus our effort. I know this is a far-fetched idea. Doc, I haven't finished my school yet. But if you haven't any dreams, then you will not have an achievable goal. Here's the thing. When you become a dentist and you open a clinic, you must know who's you gonna give or offer your service to, because this is a basic market segmentation. Please imagine if you become a dentist in the future, what type of patient will come to you? When I was in the younger age, I don't care. I do my job. I learn. I just finished my school. I have a parent that also a dentist as well. So I think my future days as a dentist will become like her. Actually, it is not. You must, sometimes some of my students ask me, doctor, do you think I need to get some specialization or master's degree? I would ask, do you have any idea in the next 5 years where you're gonna be in location and in the career path? Some of my students mostly are women. Not all of them are finishing dental schools and becoming a full-time dentist. Most of them become a full-time mom. And that is a career path you need to think about, because if you have a goal in mind, or you have a dream in the mind that someday I'm gonna doing some practice, you also need to think, where do you want to do some practice? Where do you want to do the practice. Why? Because as you can see, the market segmentation, location is also determines your market. If you practice in a big city and you practice in a smaller city, the type of patients demands also differ. So you may come to the big city and the patients are smarter, they have higher demands. You might need to take the master degree or the specialization. While in smaller cities, what you need maybe is a cheap service. So the priorities for the patient also differs. This what comes in mind. So you need to prepare yourself to that area. Because the third part is investment. Investment is if you have figured out your business model from the first two questions, then this would be easier for you because you already know what type of business do you want to make. Do you want to make a high-end clinic? Do you want to make a middle-end clinic, low-end clinic? Do you want to make it more cost-wise? So this is the investment that you need to think. And there are some game changer tools. So what do you mean by game changer? Game changer means, in my experience, some tools are really have a huge impact in the way you treat your patient. The first of it is dental loops. When you work in a very high magnification, you must push yourself to have a higher, to be more detailed, have fine motoric skills, and those will push you to have a better outcome. And for me myself, I've been using loops maybe for the past like 4 or 5 years. So after I use loops, it changed the way I work. It changed the quality of work. For me, prosthodontics, dentures, and crowns, those things I wish I had sooner. So when I start doing my formative years in dental school, I can learn to do everything much better than now. Now it's a bit too late. But again, it's better late than never, right? So for you guys who've been starting in a dental school, I suggest you start doing this. You use loops, you use ×2, ×3, so you get better and you do a more detail. So you have also some standard to your dental work. The second investment, I would say, please buy a camera, okay? Because dental photography right now is not only a tool for advertising, but also it is a tool to evaluation. So if you want to know how good your work is, you take a photo, you magnify it, then you will know. And you can discuss with your friends, you can compare to your friends, you can promote yourself. Dental photos, usually cameras, usually it can last a very long time, especially if you are very careful handling the cameras, you do not drop it. But this investment, you can start buying it now and use it in day-to-day practice. So because it is a habit, if you are familiar to use your dental camera in every occasion, then it will not become a burden when you start doing the real dental clinic, real dental practice, and you have to take your camera because it needs practice. The third investment, I would say, a light cure. Why a light cure, you said? Because most of the dental materials nowadays are usually resin-based, whether you're doing resin composites, whether you're doing resin cements, or you want to do some endodontics, you end up doing composites. And because of that, the material of the composite does matter, of course, but also the tools, which is the light cure, which is most of the light cure happens in the market doesn't have the strength, the you know the doesn't have the curing strength to make your resin really cure. And undercured resin is happening a lot, because you can see there are fillings coming off, there are fillings with post-operative pain, maybe an uncured bonding agents. That could happen also if you're doing some non-retentive restorations like a veneers, onlays. Those things will matters very much with a light cure. And some of the light cures can last very long time. So this is also a good investment to start. Okay, my third advice is to develop soft skills. So we sometimes, when we in the dental school, we do a lot of learning academically. Sometimes you forget that the person actually a human. We forget that all we learn is just dental enamels, pulp. We forget that we actually have to treat a human being. Sometimes we pursue our hard skills and you forget the soft skills. Actually, hard skills and soft skills, it comes in hand. You need to master both. Okay, let me reverse the role. You become the patient and I become the dentist. Okay, I have three qualities of the dentist: precise, I'm gentle, and I'm fast. If you have to choose just two of the quality and let go of one, what do you choose? What do you choose to let go? What do you choose to forgo? Everyone will think, I will forgo the fast. Correct? You want your dentist to be gentle and precise. And gentle and precise comes with your education. So it has to be started way early at your education. Do not treat your patient in the dental schools like a toy, like a doll. Treat it with respect. Treat it. You must learn how to be gentle. You must learn how to be how to be precise, because fast will come with experience. Right now, you are not learning. You are not fast enough. It's okay. It's okay because you are learning. But later on, after 5 years, 10 years of flying hours, you'll become fast. But to become gentle, you cannot start another 10 years and you start being gentle. It's too late, because gentle is an attitude. It is a soft skill, and soft skill must be trained early at the early years, not at the later years. Okay. You can also check some journals talking about the effect of soft skills in dental practice, and also teaching about soft skills in dental education. So soft skills, I think, really important. Not many curriculum or dental school emphasize on this, but I think you need to practice this soft skills. Okay, Dr. James, what is the soft skills are you talking about? So soft skills, you got time management, you got networking, you get teamwork, creative thinking, and the lastly is conflict resolution. So these are the soft skills designed by the office, by the working office templates. So if you want to be succeed at the office landscape, you need to have these 5 soft skills. And I think this also applies in the dental landscape as well, because networking and teamwork, it is what I'm said earlier about the wolf pack mentality, correct? But the wolf pack mentality, you need to work together, and you need to have a network. You need to have to know other dentists as well. Time management, as I said, it will come by experience. But if you let yourself not pushing yourself to be faster, you will, well, sometimes some of my students, they do some one preparation for one tooth, they can take for 6 hours or maybe 4 hours. I said, that is too long. Even though you are learning, you need to set uh, a time, you need to set a deadline, and you need to push yourself to finish between those deadlines. It will become faster, but right now you just need to limit yourself to certain times, and you need to finish everything that you've done in that time with a standard. Yeah, with the standard. So this is the soft skills that I think you need to grow. Is there any trick to grow a soft skill? I do. Join an organization. Please join an organization in your dental school, whatever that is, because join an organization, you will meet those of this five soft skills. You will train them, especially in the networking and the teamwork. And I cannot emphasize networking. Uh, for me, the networking part, you sometimes dental students thinks, doc, how do I network? Why should I do a network? Because when you do the networking, you will know more people, and if you know more people, those people sometimes will open more doors for you. More doors mean more opportunities. Again, these people might shape you as well, and maybe give you inspiration to become one of the dentists you want to be. So networking for me especially important after you finish your dental school. It's even more important, because when you finish dental schools, your circle of friends becomes smaller. You're not longer in a huge group, but you're more solitary. And because of that, whoever you meet in the previous life, which is in your dental school, matters, because those people will limit the interaction you have after you finish the dental school. And networking is not just about knowing everyone in your group, but also your teachers, your lecturers. Please be friend with them, because sometimes you can learn more than just the academic itself. You can learn about their experience as well. You can learn about their soft skill as well, which sometimes those are not the things that been taught in a dental school. You need to experience it. You need to experience it. Maybe if you can be friend, if you befriended, if you become friends with the lecturers, they might invite you to their practice. You can see firsthand about their soft skills, how they deal to the patient, how they deal with the complaints of the patient, how do they talk to the patient, how do they give suggestion to the patients, what kind of patients, what kind of market segmenting they're doing, what makes him or her unique, what is the difference, what is his style, what is her style. And those will become available for you if you do the networking. So again, I cannot emphasize the importance of networking early, at the early years at your dental school. Okay, so be more active, meet more friends, meet many people, uh, be friend with your lecturers, and go find something that might inspire you. Sometimes networking nowadays can be also done by doing the social medias. You can go for Instagrams and such. You can see that this doctor has a wonderful feed, many good cases, and maybe you want to learn with him. Be friends, not just doing the one way, just learning. You pay him, teach me, and then done. But you need to brush shoulders with them, so you will know their circles of friends as well. So again, networking means opening many doors. One doors lead to another. Yeah. My fourth note would be find a mentor. Find a mentor is a bit tricky. So for mentor is not find a teacher. Find a mentor is more of like finding someone who knows you and knows what you're good at, knows what your potentials at, and they can like guide you to unlock those potentials. Those what I call mentors. So I like this guy. This person is called Simon Sinek. Simon Sinek is a very famous motivator. He did write a lot of books. He gave a lot of good quotes, and and one of the quotes that I want you to guys to know is, a team is not a group of people who work together. A team is a group of people who trust each other. Again, this is the Wolfpack mentality. So the Wolfpack mentality, I would say, you need to work together, but not just working at the same roof. Not like some people just huddling at the same roof and then working as that. But you need to trust them. It means you need to know what they're good at, what they're not good at, and these teams usually work well. What is the relation with a mentor? With a mentor, you can unlock what part of the team you have to be. Maybe you become the leader, maybe you become part of the team. But those mentors and mentees are usually you need to find. Okay, so the best outcome for mentors is you have a mentor-mentor relationship, but having a mentor and mentee relationship also it is not bad. So this is one talk from the Simon. I want you guys to hear.
Excuse me, sorry, Dr. James. The
Yes.
video, we can't hear the sound.
Oh, you can hear the sound. Okay. Okay. Sorry. Can you read the subtitles though?
Yes, we can.
Okay. You know what? I will try to share screen now. I'll try to share screen now so you can hear also the voice. Okay, apology. This is
one of my mentors, Ron Bruder, taught me what mentorship was really all about. I met him professionally. I was introduced to him. He was very accomplished, very successful, many years my senior, very wise. We got along. And, a week or two later, I had a question that I thought he might be able to help me with. And I called him and he took my call. I'd only met him once. And then he took my call again. And then we met for lunch. He just kept saying yes. And he became my mentor, And I remember I was at his house one day, and I was leaving, and I put my arm around him, and I used the M word for the very first time. I said, "I love that you're my mentor." And he said something to me that I didn't expect. He said, "And I love that you're mine." And that's when I realized a mentor relationship is more like a friendship. You can't just walk up to a random person and say, "Will you be my mentor?" Of course. Just like you can't walk up to a random person and say, "Will you be my friend?" That's not how it works. Mentor relationships evolve because a mentor always has time for you. They see something in you for some reason that they make time for you, and they learn as much as they teach.
Yeah.
They come into it because they learn something. I never knew that Ron was getting something from our time together. I thought he was just doing me favors because he was an amazing guy. And a mentor relationship is it's a mentor-mentor relationship. So this whole idea of like you're assigned to be someone's mentor, I'm like, maybe that could work.
Well, that seems a little, again, going back to sort of a transactional, like,
It's transactional. You have to have mentors and you have to seek them out.
Yeah.
I remember when I was junior looking for a job, people would say, what are you looking for? And my standard answer in every interview as an entry-level, idiot was, that's the theme in my career.
For the next book.
I'm just a more senior idiot now. When they say, what are you looking for? My answer was always the same. I said, what I'm looking for is probably akin to looking for love, but I'm looking for a mentor. And every job that I was looking for, I was more concerned about the people I would work for than I was how much they would pay me or whether the account was high profile or low profile. And so I took jobs with like accounts that nobody had ever heard of because I didn't care. I cared about the people I was going to work for. I wanted to work with really smart, amazing people who would teach me and help me grow.
Yeah.
And that's one of the reasons I got to work with some of these wonderful people.
Yeah.
Right. Can you stop sharing? Yeah. Can you guys see me again? Yes. So that is what the mentorship. Now, my last note to myself is to start early. To start early. What do you mean start early? You mean I must go into a clinic and then work and start working in the clinic? No. That's not the idea. The idea of start early is so you can practice those additional skills, like those soft skills, before you finish your dental school. Example, maybe you start doing, soft skills and some of the hard skills needed before you finish the dental schools. Let's say you're doing the dental photography. Right now, dental photography is everywhere. You can start taking pictures before you start doing the dental practice because again, this is need practice, this need experience. I want you all to start doing the dental photography, whether you start doing with a mobile dental photography with a phone, or maybe you start doing with a proper cameras and a flash and everything. Try it out. Maybe you like the lateral flash, maybe you like the ring flash. Those needs to be tried out. Okay, you need to experience it, you need to try it, so you will know which of the style of the photography suits you. Maybe it suits your need. Maybe you need for advertising, maybe you need for education, maybe you start collecting your portfolios. As an artist, you need to have a lot of portfolios before you can start selling yourself, correct? As a dentist, you need to have a flying hours before you can start doing a good dental service. And by doing a lot of cameras, but by doing a lot of dental photography, you can track those changes before at the start you're doing not that good, and then slowly and becoming better. After a few years, you will have a comparison, and you can see how good you are in the following years, and you can push it a little, even more. You can take another photos like again for like 5 years, and you can compare. Wow, my work when I was in dental school like this, now I can do this. You can do those side-by-side photos to the social medias. People can see your progression, and people often admire how far have you been. You see, those are the stories usually people like in the social medias. And again, in the social medias as well, you can do this promotion / education of yourself. You can see YouTube, you can see you can check Instagram, you can see TikToks, you can try to educate non-dental friends about the importance of your dental health. You can do silly silly clips, or you can start taking good pictures. You can start sharing your love about your dental profession. What do you love about dental profession? Is it the detail of the work? Is it the life-changing smile of the patient? Which part of you like? You should try to do this. You should to do this early at your career. So this this concept will become not alien for you, and you can do this day by day in your dental clinics afterwards. Because for myself, to take a picture every time I do a patient and to post in Instagram for myself, I take it as a hard job. I do, because uh, I often it's easier for me to just see a patient, treat it really nicely, do a good service, do a good job, and then pat myself in the back, and then that's it. But no one can see it except for me and the patient. Right now, you can start to document it, put it in Instagram, put it in your social medias, and your friend says, "Wow, your work is getting better, yeah." And maybe your patients, your next patient also see that, say, "Oh, this doctor is doing a good job." Because you must remember that our generation will become your patient later on. Your friends, your age will become your patient later on, and those the people are used to with the social medias and such. So those are your those are your markets. So you need to apply about how their lifestyle will influence how they choose a dentist. This is started with doing the documentations and such. And how about the soft skills, Ivan? How about the soft skills? I would say if you want to train your soft skills, as I join an organization, maybe you can start by joining a charity, and you can practice those soft skills about suggesting how to talk to the patient, helping others, doing a teamwork, how to solve problems, because this charity type of uh, this usually if you start doing a lot of charities, you will see that in charities there's many variables that can happen in that event, and those problems usually needs you to, I would say, uh, problem solving. You need to think on your feet, you need to act quickly, and those will help your confidence and your problem solving skill when you're doing the dentures when you're doing the dental clinic afterwards. Because sometimes when you see patients and you think the patient's case is simple, you just do A and B and finish. In the middle of the work, you find obstacles, you find a challenge. If you haven't exposed yourself to those kind of pressure, um, you will mess up. You will mess up. So you need to see those kind of challenges in a more friendly environment, such as doing the charity work, doing this will help prepare you for those variations of events. Okay, so with that being said, we have arrived at the final conclusion. So my notes to my younger self would be this 5, which is grow with others, learn your basic business, develop some soft skills, find a mentor, and start early. Okay, this is the conclusion of my presentation. And this is one last message for me. As iron sharpens iron, so a friend sharpens a friend. This is a very famous sayings from the Proverbs, from the Bible. King Solomon said it. So for dentists, you need others. You need them to to enhance yourself. You need to learn from them. You need to network with them. You need to communicate. You need many of your friends to work together. Of course, the best outcome would be a teamwork. But again, it means you need also to be unique. You also have some set of skills you need to master, so you will become valuable in the team settings. All right. With that said, I would say thank you for listening to this presentation. Do you have any questions?
Thank you so much, Dr. James, for sharing with us. Now we will continue with our Q&A session. I already have a few questions coming in my private messages. Or a gentle reminder to all participants, please turn on your cameras and use your raise hand feature if you want to ask questions, and ask your questions directly to Dr. James. Thank you. So I'm going to read some questions that I got from my private messages. So the first question to Dr. James is, how did you find your mentor, and how did you mentor-mentee, and how is your mentor-mentee relationship, and how is your mentor-mentee relationship is still going on until present? How
Right.
is it now? Yes.
Okay. Okay. So mentors, that is a tricky thing. So when I was finishing my dental school, I was not looking for the mentors, because I think my parents, which is also a dentist, will become my mentor. That is the first mistake that I made, because if you have a senior in your dental business and you're just following their type of business, it might give you a good start, but it will not shape you to become it, because they sometimes do not know the potentials, do not know the current trends. They cannot see what is the following trends in the few years, what is the type of the market. They are giving you their market. So if I would go to my parents, I'm serving the old patients, because the market is old, is their age. I wasn't doing a lot of good practices, because most of them are dentures. But after I moved to a more younger dentist, and a more I would say up-to-date clinic, I see many markets. Then I see that my potential is not to serve the real market. Okay, I'm having troubles. Okay, so when I see another market, which is the mid to high market, and I see the kind of the aesthetic demands, the restoration needed, then I found my passion in dentistry. Because the early years of my dentistry, I was kind of stuck, because when I see dentistry, it doesn't give much variation. It's just doing the basic dentistry and dentures, basic dentistry and dentures. Then after I go out from that market and see another market, I went to another clinic. I see I see how they, the type of patient that comes to the clinic. I see the demand of their work ethics, their standards. Then I become interested into those markets, and the owner of the clinic become my first, I would say, mentor, because I learned that it should be what dentistry it should be like, how they treat the patient, what kind of restoration being done, the level of details, the standard of other dentists, the teamwork between other dentists as well. and those what propelled me into doing a specialist degree. And that is, and what I like about the prosthodontic is about restorations itself. That's why I try to master it. Later on in the clinics that I saw, a lot of dentists do restorations, but sometimes what you need is a very complex restorations, like a full mouth rehabilitations. You need to take care of all of the teeth. You need implants. Sometimes you need vertical dimensions to increase, and those are the challenge that I see. There are not so many dentists confident enough or skillful enough to handle those kind of cases. That's why I try to more specialize in those kind of cases, become a valuable part of the team. And I look for another mentor as well in that area. And I found that there are a lot of good dentists out there who's trying to give some I would say courses so you can master it, but those are the transactional ones. So I pay, you teach, and then done. I try to befriend them. Some of them are just, this is just a business, this is just an education business, so I'm teaching you, and then that's done. So that's why I try to find yeah, I try to look around, meet another dentist, check on other clinics as well, and to see, is there any dentist that fits in my description of a mentor, which is a good mentor, in my opinion, not just teaching you in one way, but also try to explore what is your potentials and what is your limit. Can we remove the limit? Can we push? Can we unlock the potentials? And then later on, uh, I entered another clinic, and that is where I met my current mentor right now. She's also my boss. But I learned a lot, not just to master the skills needed in the full mouth rehabilitation, but more of how do we see, how do we think holistically. So when you see a very complex patient and you are not trained in such a way of thinking, you only see a small part of the of the case. You only can see a small part. You cannot see the bigger picture. And to see bigger picture means you need to know what is the skills needed from A to Z. You may not able to do all of those skills, but you need to see the bigger pictures, and what is the uh, what is the requirement, I mean, like the techniques needed. And now, and after you can see the bigger pictures, you can also know which part of the team member should get into. Is it the endodontist? Is it the implantologist? So you learn to see the case much wider. You also have a bigger discussion. You also can get more input from the team as well. Maybe the implantologist give some suggestion that we can place some implants. Maybe the other team member says, but those implants would be endanger some nerves, or there's some surgical risk. And those discussions usually must have a team leader. That the team leader usually gives a wise perspective and gives what is the practical one and what is not. And that is what I'm been trying to learn from my mentor right now. And the mentorship also comes in two ways, because I also give another perspective in digital dentistry, in dental photography, also share with her. So we learn from each other. That is what I think a good. I'm trying to find those mentor to mentor relationship, but yeah, again, right now I think I found one, and from my perspective to my students, and some of them I will not call them any students anymore because many of them has graduated. So I would say they're my juniors. Do I give some mentorship to them? I do. The mentorship actually most of it become mentee and a mentor because I give it one way. So sometimes I have what we call a charity case. Some of my juniors find an interesting case, and when I see the case, I would say, okay, you can try to do it in my clinic. We will not charge the case. We will not charge the patient. We will do it for free. But every step of the way, I need to oversee. But you guys will do it because this will add experience to you. And those are the kind of mentoring that I give to my juniors. But again, it happens before the COVID-19. Now with the COVID-19, the mentoring program kind of stopped, pause for now.
Thank you, Dr. James.
Yeah.
We have a few more questions here. The second question is, when did you realize that being a dentist is the right job that you want?
Okay. So I graduated at 2006. So when I was graduated in 2006, if you ask me, do I really want to become a dentist? The answer is I do not know. I do not know. Okay, at that time I was going through the motions. I was not fully aware of my potentials. Do I really want to become a dentist? How does a dentist work? What is the working environments? But later on, after a few years of frustration, then I try to connect with some of my seniors. I try to check on their clinic. That is what triggers me. That is what triggers me that, oh, actually dentist is a very wonderful job. If you can find the passion, if you can do it with love. And for that, the love part, I don't get it at the first. I was magically transformed to a dentist. I'm just finishing my school. But after I found those clinics and see the way they treat that patient, it does inspires me, and that inspires me that, oh, okay, I want to be that kind of dentist. I don't want to be a dentist who just wake up and treat patient and go home, but I want to see a dentist that really has a mission to change the patient's life. And changing the patient's life doesn't you cannot do it just doing a very simple feeling. You must change his life by making like a smile design. You must yeah, those are the things that moved me, that said, oh, okay, that's why I wanna do the dentures, because the dentures do give a huge impact for the patient itself, especially psychologically. So that's why I'm doing the prosthodontic specialist. Later on, I met many people again. That is why I try to sharpen my focus to become not just a prosthodontic, but I want to do a prosthodontic that deals more of like the functional part of it, because I see the functional part, it usually there's an occlusion part in it, which is the occlusion part is a really hard a subject. I try to master it, which many dentists haven't mastered. So I become infallible. That is what my USP is. My USP is I'm doing the more occlusion part, which other dentists may find it hard, or refer to me. So you need to become a unique dentist, so other dentists can rely on you as well, or maybe you can work from again a teamwork. Is that answer your question?
Thank you, Dr. James. I actually have a few questions of my own, if that's okay.
Yes. Okay. Sure.
Okay. So My first question, I actually have two questions for you. The first question is, how easy is it to ask permission to patients to do dental photography? And, do they reject the proposal or a lot, or do they agree for it to be published? And my second question is, how do you handle patients that complain about your work, and how do you resolve it? Thank you.
All right. Okay. So the first one, if you want to do some dental photography for the evaluation itself, it's usually easier to ask the permission to the patient. What is hard is when you try to do the dental photography and you want to make it as a promotion or as an advertising. That is a little bit harder because the patient's privacy would be exposed as well, because if you want to do the full shots of the face, it will become, yeah, nowadays privacy matters. Privacy matters. That's why if you want to do the case for the promotion or for the advertising, I would say number one is to select your case. If you have the experience, you will know that this kind of case, if I did it right, it will become like life-changing. But this case, maybe just a feeling. If I do this one, then it will not become life-changing. So if the case have a huge impact, then you can start by asking the patient first, do you allow me to publish the photo as a part education and a part advertising? Maybe I can give you a discount for treatment as well. Then you must make a deal with the patient first. That is for the advertising. Usually nowadays, if you give an extra bonus for them as well, like a discount in the treatment, and discount in the treatment, usually they agree. Usually they agree. And the third part is about how do you handle complaints from the patients. So handling complaints is also a necessary skill in our service, because our service is as a dental service. We will meet many people. Most of them maybe will complain. The first thing you need to react to complaint is never get emotionally involved. A complaint is a complaint. A complaint. You should never take it personally. The second thing is, when you see a complaint, you need to see from their shoe. Sometimes they just want to express their discomfort. They just want to express that I have a pain. It is not to attack your reputation. It's not to attack. Give your work a bad name. So what you need is to see, does this discomfort comes from your lack. Does your work have something lacking off? Do you have lack of protocols? Do you have done it in a hurry? If yes, then you said that you will try to redo it and make it better. So if you've done it in a hurry, then make time for the patient. If the patient comes, the complaint does come from the side effect of the treatment, of the procedures, then this should be a lesson for you, that you should tell the patient firsthand. So before the patient leaves the clinic, you must tell the patient that these things can happen. It's a probability, but if these things happen, you should do this, or you should take this medication. This thing will go off in a few days or a few hours. Then you need to inform the patients. And the lastly part is, if the patient, the complaint comes in a form of failure of our restoration. The failure of our restoration, the first thing you need to see is you need to know when the restoration was made. If the restoration was made not too far, early in the maybe in the next in the first 2 months, then it is a failure of a technique of a failure of a failure of protocols. Maybe you haven't done the burning protocols right. Maybe you haven't done you choose the wrong material for the case. Maybe you prepared not enough space. But if the failure comes after 3 years or 5 years or 10 years, then it is a failure by design, because the restoration should not last that long. And if it has been last that long, it means there's already some mechanical failures, maybe some micro leakage, maybe there's a discolorization, maybe there's a chipping on the tooth itself. So this is so you need to see which failure, and you need to address the failures depends on the time. Okay, because it is important that you need to know, is it a predictable failure, or this is the unpredictable ones. So that's I think how you should see a complaint.
Thank you so much, Dr. James. Thank you so much. Unfortunately, due to our limited time, that will be all for the Q&A session for today, Doctor.
All right, thank you.
But before we go on, we kindly ask Dr. James and all participants to please turn on their cameras, as we will now take documentations. To all the committee, please go right on ahead. Thank you.
Okay, thank you, Richard. Now I'm going to take a screenshot for the documentation. 1, 2, 3, smile. Thank you, Dr. James and everyone. Thank you, Richard.
Thank you so much. Once again, thank you so much, Dr. James, for taking time out of your busy schedule to be the speaker on Bedah Buku today.
You're welcome. Again, apology for the I haven't tell everything that I want to tell, but I got this anxiety. But okay, I hope you get some notes from all this talk. What I want to say is, please go find please do some networking. Please do some networking. Meet many people. Befriend your teachers. Check other dentists as well. Check other clinics as well. Open your social medias, not just to see or to shop, but to find inspiration, because follow other great dentists that may give you inspiration. If you want to look for a mentor, I would say first you need to know what do you want to be, what dentist do you want to be. Okay, what dentist you want to be. Then you can find those mentors in the same field that you want to pursue. Because if you just graduated and then you said just I want a mentor, you do not know what you're looking for. First, you must know what you're looking for. First, you must know, do you want to become a dentist, or do you not want to become a dentist? If you want to become a dentist, what kind of dentist you want to be? That might shape the goal you're pursuing it. Okay.
Thank you. Thank you so much, Dr. James, for the advice. I'm sure everyone here appreciates it because I sure do. Thank you, Doctor. So now it is the time we all have been waiting for. We will announce not 2, not 3, not 4, but 1 lucky participant who'll be winning the lucky prize on this event. So without further ado, the winner is, sorry, not 3, not 4, actually. I have an update here. Turns out there will be 2 lucky winners. So without further ado, the winners are, please direct your eye. Cindy and Yasmin. So all the winners, congratulations. Please turn on your cameras as we will now take pictures for documentations. To the committee, please go right on ahead.
Okay, for the winner's documentation, 1, 2, 3, smile. Thank you.
Thank you.
Our committee will approach you, Yasmin and Cindy, for your contact information regarding the prize. And now, it's unfortunately time for our last agenda for today. As you guys all can see on your Zoom chats in a few moments, there will be a link you can click to open a form for all participants to fill. As I stated earlier, e-certificates will only be sent to participants who fills in this form. E-certificates will be sent 1 week post-event at the latest, so please be patient if you haven't received your e-certificates yet. To conclude all our agenda for today, to conclude our event for today, we, the committee, would like to thank every single one of you for your participation on Bedah Buku, Spreading Knowledge Throughout the Nations, one of Nusantara Smile Campaign's 2021 sub-program. We hope to see you next year. I'm Richard, and I'm signing out. Good afternoon, and wassalamualaikum warahmatullahi wabarakatuh.
Shining bright, shining